In dentistry, there is a wealth of evidence that highlights the potential strain placed on our backs while working as an operator, or likewise being an assistant. Research by Brown et al. 2010 looked into reasons for early retirement, and musculoskeletal was the most common, highlighting the need to correct our posture in undergraduate education. This video will demonstrate how to sit correctly when treating patients. The patient's head should be in the 60 to 90 degree region. Your arms should be in the neutral position as shown on the diagram. The same principle also applies when working in the clinical skills labs. Your chair should be adjusted by using the levers underneath to accommodate your sitting position. The operator should sit as close as possible. Both feet should be flat on the ground and upper board of the thighs should be slightly bent. The back should be straight and shoulders should be horizontal and not raised. Both arms should be in light contact with the rib cage. Also try to sit more on the edge of your seat to encourage you to sit up straight. You also need to move around the patient's head to get a better view of the oral cavity, which will enable you to work with good posture. For example, when treating the upper right buccal surface, you move to the 11 o'clock position and ask the patient to turn their head slightly towards you. Likewise, you could also get the patient to point their chin to the ceiling to get a better view of the oral cavity from a different angle. If nursing, sit about 10 centimeters higher than the operator. This enables you to see the operator's hands and gives you a good view of the oral cavity. Many dental nurses sit at the same height as the operator, which results in them leaning forward and putting strain on their back. It's important that you sit 45 degrees to the long axis of the patient. Following this guidance will ensure safer working practice.